Joining us now is Dr. Robert Murphy. He's a professor of infectious diseases at Northwestern University Feinberg School of Medicine. Good morning.
Good morning, Larry. Lauren.
Now, we realize people who, may be vulnerable should get this shot, but I think the rest of us are wondering how important is it to get a vaccine at this point?
Oh, well, it's very important because the virus has changed so much that the shots that we had before at the beginning of the pandemic and then the bivalent booster that came out a year ago, September 1st, basically don't work anymore. It's very similar to the flu vaccine. You have to have a new one every year, and that's what's happened now. The FDA approved it on Monday, the CDC approved it yesterday, and it will be available as early as tomorrow.
Dr. Murphy, is this similar to the flu vaccine where it's designed for a previous variant? Because from what I understand, it was something like maybe the variant that was going around in the spring, but it's similar to what is now affecting people.
Well, it still takes months to make these vaccines.
Yeah.
So, and these waves of variants come, it doesn't come like in a week. So, yeah, this is designed after the XBB 1.5, which was about 6 months ago, the common Omicron variant floating around. But it should cover what's happening right now.
Yeah, so is the biggest risk for people, let's say, who blow this vaccine off, that somehow perhaps they spread it to people who are more vulnerable? And what is the hospital capacity? Is that something that we've learned our lesson from the previous waves?
Well, I don't know if we ever learned our lesson, really, but that is exactly what can happen. If you just blow it off, and you're more likely to get COVID, you're more likely to spread it maybe to somebody who is vulnerable, and that person can get sick. You can get sick yourself. There's a study in like 6 or 7 states here, just in children, because that's another issue altogether. And they found that the kids that at least had the bivalent vaccine stayed out of the emergency room, stayed out of urgent care, basically were healthier, 80% effective. So it's effective even in children.
I think when some people hear, okay, now it's recommended that I look at the RSV vaccine, I look at the flu vaccine, and I consider the COVID vaccine, that does seem like a lot of vaccines. But what would you tell people about what potentially could be the respiratory season going forward in the fall and the winter?
Well, if you want to stay out of the hospital, and you want to stay alive and healthy, you're going to want to get these vaccines. Now, the flu vaccine and the COVID vaccine are approved for everybody 6 months age and older. The RSV vaccine that you mentioned is only for people 60 years of age and older, or if they have some underlying severe disease. So that's not for everybody. But, you want to be getting vaccinated. You as a kid, you got vaccinated for many, many diseases. You didn't get them. This is just more, and it happens to affect people of all ages.
All right, Dr. Murphy, thank you.
And Dr. Murphy still answers COVID-19 questions on Northwestern University's Institute for Global Health Facebook page. You can also submit questions by Facebook, message, or via email. Dr. Murphy, thank you.
Thank you.
Great. Have a nice week.
You too.